Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about thanatology. So, thanatology means it is study of death, like the study into the death, all the aspects of death. That is what we are going to study now. So, this thanatology is very important and this definition is important. What is thanatology? It is study into the death. There is something known as taphonomy, and this taphonomy means it is study into the decomposition of body. All the post-mortem changes that occurs in the body, that study will be known as taphonomy, right? So, this is the thanatology where you will be seeing the taphonomy and the immediate changes and what are the criteria where we pronounce the death. So, first we have to have a little idea about death. So, first is lethal event. When we say lethal event means it is the cause that results in death. It could be hanging, it could be myocardial infarction, it could be some accident, anything, any cause that results in death is known as the lethal event. Now, once this lethal event happens, what will happen is that somatic death will happen. That is, all your cellular activity, meaning your respiration, circulation and movement will stop. This thing, death as we see it, when someone dies, what we experience, there will be no respiration or circulation, any movement, right? So, that apparent death, it is known as somatic death. Only your body has died. But there is something known as molecular death. So, molecular death is where actually the insides of cell at molecular level dies. That is, stop working. That is your molecular death. So, what we mean by molecular death? At cellular level, when all the activity ceases and all the molecules inside the cell dies, that is when we call it as molecular death. And what we usually witness is this somatic death. And this molecular death, it will happen only after an interval, right? So, there will be one time interval between this somatic death and the molecular death, and this interval, this is very vital for organ transplantation. This is where you will be doing all the organ transplantation. We have declared someone as dead, and within few hours or few minutes all their cell will completely lyse, and before that lyses you have to transfer the organs, and that interval, that vital period, we call it as supravital period. So, this supravital period's importance is that transplantation of organ can happen only during that period. Clear? So, this is your somatic death, molecular death, which follows the lethal event, and this forms the very basic of the thanatology. What is a lethal event? What is a somatic death? And what is a molecular death? And what is this supravital period? What is the importance of this supravital period? So, this is your basic thanatology. Now, we will go deep into the thanatology. So, first we have suspended animation. So, suspended animation means it is a state of apparent death. Means they will look like dead but not actually dead. They will look like dead but not actually dead. So, this is your suspended animation, and this suspended animation, it was very common in the old period. Why? Because that time there was no medical advancement, there was no ECG, no stethoscope, lot of things were not available during that period. So, if someone sees someone not respiring or not seeing any blood circulation, or if there is any absence of voluntary movement, they will simply pronounce them as dead, and they will also bury them. So, what happened was that, like in lot of cases, after burying, people came up from the burial place. So, this they gave a name, Lazarus syndrome, that people coming alive after getting buried. So, this is Lazarus syndrome, and this was happening mainly because of this suspended animation. So, what causes this suspended animation? There is a certain list. So, this suspended animation, it is voluntarily done by yogis. So, what they will do is, they will voluntarily put their body's metabolism into very low mode. Okay, so it will be very low metabolism, so that there will be no active respiration, there will not be any activity. Their body will survive with the oxygen dissolved in their cell. So, using that very minimal oxygen, the metabolism will become very low, then body will survive. They are not actually dead, but they will look like they are in a state of death. So, this low metabolism is the reason why they look like dead, and this is voluntarily done by yogis, and it is involuntarily or accidentally done in certain cases. Those are very important because this is where you usually come across this suspended animation. This is most commonly seen with newborn. And electrocution, hypothermia, heat stroke, and drowning, concussion. These are very commonly seen. So, all the forensic important conditions, just newborn, your drowning, electrocution, concussion, all the unnatural conditions, you can expect these. Apart from that, you can expect that from barbiturates and infection like cholera and typhoid and opiates. So, all these conditions, you can expect this suspended animation, and this suspended animation, the metabolism will become very low, so they will look like they are dead, and people, they will make mistake that they are dead, and that is why there are a lot of stories coming. Right, people will wake up while doing autopsy, like while putting the incision, they will sit in the table, like that there are a lot of cases coming. Why? Because this declaration of death is not properly done. They will simply say like there is no movement, there is no respiration, he has died. Like that people will simply declare and they will bury them. So, this suspended animation like stirred up a like kind of confusion. So, what they did was they wanted to make sure whether the person has died or not. So, they came up with this concept of criteria of death. So, this Bichart's criteria of death is known as tripod of life. What they say is the tripod consists of circulation, respiration and brain activity. These three consist of the tripod, and if any one is absent, if any one leg of tripod breaks, the tripod will collapse, that is death will occur. So, that is what their concept is. So, they wanted to check for circulation, respiration and brain activity. This is what they wanted to check, and they could come up with certain tests which are not used right now, but once like very old period they were using this only. So, for circulation they had these tests, Magnus test, where they will put a string around the finger. So, they will put a string and they will release it after some time. So, when you put the string, it will become pale, and after you release it, if there is active circulation, the blood will go and fill up the pale area. So, by seeing that, they say circulation is present. So, this patient is not dead, they are alive, like that they concluded. And they also used ICARS test, like they will inject fluorescent. If there is active circulation, it will be carried along the blood, like that they find out. And diaphanous test, they will look for the transillumination. What they will do is, they will put light over your finger, like between the webs of the finger they will put light. If active circulation is there, then the color will be bright red. If it is only venous blood staying there, it will be dark blood, meaning oxygenation is not happening. Like that all the obsolete tests were used. Now none of these tests are being used. This fingernail test is also there. They will put pressure and they will release. Once the pressure is released, if circulation is present, it will look red. So, these are other tests for circulation which they were using in the older times to find out the person is dead or not. Next, what they have is respiration test. They had Winslow test which look for the chest wall motion, and mirror test is like they will put mirror in front of the nose. So, in front of nose they will put a mirror. If breathing is happening, that breath air will come and hit the mirror and it will cause some humidity. So, there will be water droplet present over the mirror. So, they will confirm that respiration is happening. And feather test is they will place a feather over the chest wall, and if that feather is moving, then means respiration is active. So, like that they had a lot of tests to find out whether the person is alive or not. But nowadays we are not using any of that. What we are using is these criteria, because we had the concept of beating donor. So, what beating donor is that their heart is actively pumping blood, but their brain is dead. They are in a persistent vegetative state or they are in a brainstem death state. So, this is what beating donor means, and these beating donors, the viability of the organ was very good. So, we had the concept of beating donor. So, in order to take the organs from these beating donors, we had to come up with certain criteria which find out whether the brain activity is there or not. So, these criteria are Harvard criteria, Philadelphia criteria and Minnesota criteria. So, these tests, the main differences I have put here. So, this Minnesota criteria is what we are like very widely follow now, because this looks for brainstem death, that it will only check the brainstem reflexes like your corneal reflex, pupillary reflex, gag reflex, all the brainstem reflexes are tested. So, what happens is that the person, they can either have a brain death or brainstem death. If it is a brain death, what will happen? There will be respiration. The respiration will be actively happening, but there will not be any perception or any voluntary movement. So, that is the stage we call as coma. And brainstem death means here the respiratory center will be affected. So, there will be apnea. There will be no respiration, but all the brain activities, it will be happening. So, this brainstem death, even if it happens, even if the brain is actively working, nothing can be done. So, this brainstem death is what we look for beating donors nowadays. And to check whether brainstem is alive or not, we will do these brainstem reflexes, corneal reflex, pupillary reflex, gag reflex, all these reflexes we test for. And how to test for them and what is the frequency of testing, who all can test these brainstem reflexes, that is what given in this criteria. So, Minnesota criteria, the duration for testing respiration is 4 minutes, and spinal reflexes, it is not important, only brainstem reflexes is seen here, and pressure falling, that is not specific requirement here, and repetition of test is done after 12 hours, and in between these two tests we have to put the respirator back on. So, because of this respirator putting back on, organ retrieval is highly possible in these donors. So, because respiration is happening, the organ will be viable and they will give good yield. So, this is very important with this Minnesota criteria. And who can pronounce that? There is no specific recommendation on this. The treating RMP can give the result, like anyone can declare the death. So, this brainstem death Minnesota criteria is very important. And we have two other criteria, which is Harvard and Philadelphia criteria, which basically looks for brain death. And between these two, the main difference is that like you have to wait for 24 hours, you can before repeat the test. Okay, both the tests you will do for 3 minutes. Both tests you will be looking for spinal reflexes, and arterial pressure, it is required here in this and not in this, and the main difference comes of in these two. So, repetition of the test, it can be done only after 24 hours in this Harvard criteria, but it is done after 2 hours in Philadelphia criteria. The name is longer here, but the duration is shorter, 2 hours Philadelphia. But since the interval is shorter, we cannot put the respirator back again. So, respirator should be disconnected, and for 2 hours it should be disconnected, and only after 2 hours you have to repeat the test, and you have to declare them dead or not. So, between these 2 hours, this organ damage will occur. They will become dead. So, this organ retrieval was not possible in this Philadelphia criteria. That is the main disadvantage of this. Apart from that, they needed like specific criteria, like these people only can declare the death like that. They had some criteria, those protocols. That was also kind of an hassle. So, this hassle is now completely reverted by the introduction of this Minnesota criteria, and this is widely followed right now, and this is how the death is pronounced nowadays. To avoid the suspended animation and Lazarus syndrome, this is how we are pronouncing death, especially in case of beating donors, and this is very important while retrieving the organs for donation. So, this is the thanatology death declaration part. Next, we are going to see about sudden death. So, what we mean by sudden death? What is the definition of the sudden death? When we say something a sudden death is, if there is death that is occurring within 24 hours of onset of symptoms. So, 24 hours of onset of symptoms, if any death occurs, then we call it as sudden death. They may be previously normal individual, but they will have something, some symptom, like they will have some chest pain, and within 24 hours of the chest pain, they will die. This is what we know as sudden death, right? So, now what are the common causes for sudden death? It is mostly serious causes. Serious is the topmost contributor in this sudden death, and in cardiac causes, what you can explain? All these negative autopsy things, like your Brugada syndrome, your arterial spasm, spasm of coronary artery, your myocardial infarction, all these can be the cause for sudden death. So, cardiac remains the first contributor to the sudden death. In case of respiratory, there can be bronchial asthma. When there is like severe bronchial asthma, it can happen. And in CNS, it is mostly aneurysm rupture. So, rupture of aneurysm, and suddenly because of hypertension, there will be parenchymal hemorrhages. Uncontrolled hypertension, you can get parenchymal hemorrhage. So, these things can result in CNS sudden death, and in GIT, you can expect pancreatitis, acute pancreatitis, and appendicitis rupture. So, all these in GI you can expect sudden death. And anaphylaxis, this is most common cause. This is most common single condition that can result in the sudden death. So, all of a sudden they will develop some allergic reaction, it will become full blown anaphylaxis and they will die. So, this is the most important thing related to sudden death, and in this sudden death, whenever you deal with the sudden death, the important thing you have to note is history, and depending upon the history you have to do your autopsy, you have to take your autopsy technique. So, depending upon the history you can suspect whether it can be a CNS related or CVS related, respiratory system related, you can identify and come to a conclusion. So, this is the importance of the sudden death, and lot of autopsies that you will do. Apart from these like homicidal cases, all the natural death, like it will come in this sudden death only. So, sudden death is very important concept in forensic medicine. So, thanatology, you had what? The somatic death, the lethal event which goes into stomatic death, and then molecular death, then the concept of suspended animation, and to combat that suspended animation, they came up with the criteria for death, where they will look for circulation and respiration with some obsolete tests which are not followed right now. What we are following right now, especially for the organ donation, the concept of beating donor, what we are following right now is this Minnesota criteria, where you will mainly look for the brainstem death by checking the brainstem reflexes, and this test, it can be repeated within 4 minutes. It can be like done for 4 minutes and repeated within 12 hours with respirated back on, which will help us to retrieve the organs. Apart from this Minnesota criteria, you have two other protocols, which is Harvard and Philadelphia criteria, where you will look for the brain death. So, if it is brain death, you will have active respiration present. If it is brainstem death, there will be irreversible apnea. This is how you mainly differentiate this brain death and brainstem death. And the concept of sudden death, where the death occurs within occurrence of 24 hours of the symptom, and the most common cause of sudden death is your serious death. Apart from that, you will also have the CNS, respiratory and anaphylaxis causes leading to sudden death. So, this is the bulk of the thanatology. Then comes the another part of thanatology, which is your post-mortem changes. So, post-mortem changes is very important, and this has been asked multiple times, and this is a very important long question. So, when we say post-mortem changes, we broadly divide them into three. We have immediate changes, early changes and late changes. These are the broad classification of post-mortem changes. So, in immediate changes, what will come is that there will be loss of respiration, loss of circulation and loss of voluntary movements. So, this consists of the immediate changes. When they ask you what are immediate post-mortem changes, you cannot say this Tache Noire, all the eye changes. What you have to say is this loss of respiration, circulation and voluntary movements. These are the immediate changes that will happen right after the death. And after that comes your early changes. Early changes we will see in lot of sections. So, first is your eye changes. Next, you will be seeing changes in the skin. Then you will be seeing changes in the muscle. So, these early changes we will be seeing in detail. And after that comes the late changes. So, late changes, what will happen is that it is mainly the process of decomposition. So, you will have autolysis and you will also have putrefaction. So, this decomposition, it consists of autolysis and putrefaction. So, these are the broad classification of the changes that happen after the death. So, post-mortem changes broadly classified into immediate changes, early changes and late changes. Immediate changes, it consists of loss of respiration, loss of circulation and loss of voluntary movements. Early changes we will be seeing in lot of sections like eye changes, skin changes, muscular changes, and finally late changes, which consist of decomposition, where you will be getting autolysis and putrefaction. So, these are the post-mortem changes. Now, we will go into the early changes. First, we are starting with the eye changes. So, in eye, the first thing that you will be noticing is loss of corneal and pupillary reflex. This is the first change you will note, and after that you will see this. This is known as Kevorkian sign, also known as cattle truck or railroad appearance. So, what happens here is that, like, do you see here, this is your retina, right? Here the blood vessels, there will be lot of segmentation. So, this segmentation of blood vessels in retina is known as this Kevorkian sign. So, retina, if you look at the blood vessel, there will be multiple segmentation, and this Kevorkian sign, this happens immediately. Okay. So, in the eye changes, you will first see pupillary reflex, then you will immediately see this Kevorkian sign, and after some time has passed, you will be able to see this one. This is your Tache Noire. This is mainly due to drying up of your conjunctiva. If the eye is open for a very long time, then the Tache Noire will be very prominent. So, what happens is that there will be a triangular, there will be a triangular discoloration, and the triangle apex will be towards the canthus and base will be towards your cornea. So, this is how Tache Noire looks like. The base of the triangle discoloration, it will be towards the cornea and apex will be towards the canthus. This is how Tache Noire will look like, and this is mainly due to drying up. And apart from that, what else you can experience is that there will be vitreous changes. There will be alteration in the potassium levels, and the eyeball pressure will fall and it will become flaccid. Flaccidity of eyeball will also be seen. So, these are the common yearly changes that you will be seeing in the eye. So, first there will be loss of pupillary reflex, then after that you will see the Kevorkian sign where there will be segmentation of the blood vessels seen in the retina. And this Kevorkian sign, it is also known as railroad appearance and cattle track appearance. Then you will get to see the vitreous changes with alteration of the potassium levels, then flaccidity of the eyeball due to loss of the internal ocular pressure, and Tache Noire due to drying up of the conjunctiva where you will get a discoloration, triangle shaped discoloration with the base of the triangle towards the cornea and apex towards the canthus. So, these are the yearly eye changes. Next to the eye changes, what we are going to see is Livor Mortis. So, Livor Mortis, it goes by lot of name. First name is hypostasis, also known as post-mortem staining, darkening of death, bruises, sugillation. All these are other names for this Livor Mortis. So, basically what happens is that the skin will become discolored. Like there will be discoloration, especially bluish discoloration of skin. Most commonly you will find blue color, sometimes color will be different in certain conditions. So, what will happen is that you will have the bluish discoloration of the skin, and how it usually happens is that the mechanism behind this Livor Mortis is that this is a gravity pooling of blood. So, what will happen? Once death occurs, there will be loss of circulation. So, blood will stay in the blood vessel, and if the body is also not moving, if there is loss of movement also, wherever the blood is there, it will be staying there only. If the person is supine, all the blood will be in the gravity area, like dependent part of the area, the blood will pool. And once the time goes, this blood will stain the skin. Right. So, the blood pigments, hemoglobin, it will stay there for a very long time. As the time losses, as the cellular integrity losses, the pigments will start staining the skin. So, this staining we will see as a bluish discoloration. This is known as hypostasis. So, basically what happens is that there will be gravity pooling of blood, and after the pooling happens, the blood pigments will start discoloring the skin. This is how this hypostasis occurs, and this is the mechanism of hypostasis formation. Now, what is the site of appearance? So, what happens is that this usually found in the part of dependent. So, if a person is supine, it will be seen in the back, the posterior aspect of the body, it will be seen. If they are prone, it will be seen in the anterior aspect of the body. So, this is how the hypostasis is seen. Like whichever body is dependent, there you will be able to witness this hypostasis. If a person is hanging, then it will be seen over the dependent part, that is your arms, hand and legs and foot. So, this is where the hypostasis occurs in hanging. And if the body's position has been constantly altering, if there is continuous movement, someone is keep on changing the appearance of the body, then hypostasis will not appear, because there will be no time for pooling up of the blood. So, this is how hypostasis happens. We have seen the place where hypostasis will be visible. Now we have to know what is the time of appearance of hypostasis. This is very, very important. So time of appearance of hypostasis, it will start by 30 minutes to 1 hour. You will be getting to see in patches. Small patches of hypostasis will be able to appear as early as 30 minutes and after 6 hours. So between 6 to 12 hours, there is something known as fixation of hypostasis occurs. So by 30 minutes, it will start forming a patch and by 6 to 12 hours, it will fix. So what I mean by fixation of hypostasis? So first, fixation of hypostasis means if there is a hypostasis, if there is a discoloration, what you have to do is you have to press it. So you will use your finger and you will press over that region, and if it blanches, that means hypostasis not fixed. If it does not blanch, the color stays, no blanching, that means fixation has happened. So this is what I mean by fixation of hypostasis. And why we are talking about the fixation is that there is something known as primary and secondary hypostasis. So primary hypostasis is something that forms initially. So this is the first hypostasis that forms, like as early as 30 minutes it will start to form, right? That is the primary hypostasis. Now before 6 hours, if the position of the body is changed, before fixation, that is 6 hours, if position of body is changed, if position is changed, then what will happen is that the hypostasis will reform at different position, and this reformed hypostasis is known as secondary hypostasis. So we will take an example, like somebody is killing someone. They will like in a moment like of some fight or something, they are killing someone and they will just leave the body. They get panicked and they are just leaving the body as such. So the body is initially, the body is in a supine position, and after going to the home, that murderer, he thinks, okay, maybe we should try to make this look like a suicide. So he is getting that idea and he is coming back again, and he is coming by some 2 to 3 hours. So he takes the body and he hangs the body. So after that, the body is hanged. Now what will happen? These 2 hours, the body was supine, right? So during that period, there will be hypostasis over the back. There will be hypostasis over the back of the body, and this hypostasis is known as primary hypostasis. Now after 2 hours, he comes and he hangs the body. So 2 hours means fixation could not have happened. Now what will happen? The hypostasis will form over the palms and feet. So this is where hypostasis will form again. So slowly from the back it will go to this palm and sole, and this hypostasis is known as secondary hypostasis. So when they come to the mortuary, when they bring the body to the mortuary, you will be able to identify hypostasis at 2 places, one over the back and one over the palm and the feet. Now by looking at these 2 different hypostases, you can say that the body has been altered, the position of the body has been altered. So this is our inference. So this 2 different hypostasis means position of the body was altered. This is what we try to get from this primary and secondary hypostasis, and this is very, very important in finding out the nature of the crime. So this is very, very important. Primary hypostasis means before fixation, what happens is primary or hypostasis, and Before the fixation, if the body is moved, then again hypostasis form in another location, which becomes your secondary hypostasis, and this will be used for identifying any alteration in the position of the body after death. So this is your primary versus secondary hypostasis. So now we have seen the site of appearance, time of appearance, and fixation, non-fixation, and primary versus secondary hypostasis. Now what we are going to see is color of hypostasis. Like I told you before, mostly it will be bluish discoloration, but sometimes what will happen is that the color will be different, and that color will give us a clue of the cause of death. In certain poison, in certain condition, the color of the hypostasis will be very peculiar. So first is your black color. This is seen in mummified bodies and opiate poisoning. In these cases, you will be seeing black discoloration, and if it is a hydrogen sulfide gas, you will get bluish green. Mostly green color hypostasis is seen. Not just hypostasis, all your body parts like organs, blood, everything will become green in case of hydrogen sulfide poisoning. Then if it is a asphyxia, you will get dark color hypostasis. There will be dark color hypostasis. That is what looks like this bluish violet. So we have another thing known as like intense hypostasis or very less hypostasis. Like what are the conditions that affects the nature of the hypostasis? If it is a asphyxial death, you will get more intense hypostasis, and if it is a sudden death, you will get more like very dark color hypostasis, and it will also form very early. And if it is a case of anemia or hemorrhage where there is no blood in the body, in such cases the hypostasis intensity will be less and it will take more time to form also. So this is also asked. So they will ask you where you will be seeing very less hypostasis, where you will be seeing more intense hypostasis, like that they can ask you. So one such condition is your asphyxia. And next we have is this bright pink, because when the oxygen is not utilized, if it is still present in the blood, it will give this bright pink color appearance, and it is usually seen in hypothermia and refrigerated body. There the oxygenation will not happen properly. So this bright pink appearance will be seen in that. And bright red color, brick red color, it will be seen in cyanide poisoning, and this carbon monoxide poisoning also will give this cherry red color appearance. And this yellow color or brown color is seen with phosphorus poisoning, and chocolate color, it is an important question. They will ask you where you can see chocolate color hypostasis. So you can remember this by using mnemonic: ban, PC and chocolate. So you can remember this. So B for bromates, N for this aniline and acetoaniline, N for nitrites and nitrobenzene, then P for potassium bicarbonate. So ban, PC and chocolate, you just remember using this mnemonic. So this aniline, acetoaniline and bromate is very important, and they can cause chocolate color hypostasis. So these are the important thing about hypostasis. So Livor Mortis, other name is hypostasis, post-mortem staining, darkening of death, sugillation and vibisis. And the mechanism how it occurs, this is due to gravity pooling of the blood. And what is the dependent portion of the body? There you will be getting to see this hypostasis. Usually it is blue in color. Under certain poisoning, the color change will happen. And the important color changes we have to remember, that is given in the table. Now, what is the time of appearance? So it will appear as early as 30 minutes and it will fix by 6 to 12 hours. And if the position of the body is altered before fixation of the hypostasis, you will get hypostasis at two different sites. So the first form hypostasis is known as primary hypostasis, and second form hypostasis is known as secondary hypostasis. And by fixation of hypostasis, what we mean is that when we give pressure, it will blanch if it is not fixed. It will not blanch if it is fixed. This is fixation of hypostasis. Now, the important query that will come is that there will be some confusion between hypostasis and bruise. Whether it is a contusion or hypostasis, that is the next question that will come up. So now what will happen is that both have blood, like both will cause discoloration. So because of the blood, there will be discoloration in both. Now in the post-mortem condition, you should be able to identify which is hypostasis and which is bruise. And how we will identify is that we have certain criteria. So first is your incision test. So if you put an incision over the hypostasis, like over the discolored region, if it is a bruise, the subcutaneous tissue will be stained. Like you can see the blood. You can see the extravasated blood in case of bruise. If it is not seen, if it is like clear, pale, then it is a case of hypostasis. So this is the first criteria. Apart from that, this bruise, it can be seen anywhere over the body, bruise, and the margin is well defined. You can easily make out the margin, and these bruises, they will sometimes have abrasion along with them. Abrasion along with contusion will be present. So these are the main differences between this hypostasis and bruise, and they normally ask you how will you differentiate a hypostasis and bruise in the post-mortem setting. What we mainly do is that incision. When we make an incision, if the subcutaneous tissue is white, it is a case of hypostasis. If it is dark, then it is a case of bruise. So this is how you differentiate hypostasis and bruise. Now there is one more thing that is known as contact pallor. So what this is that, like if someone is wearing some tight collar, okay, some tight clothing or tight blood, over that area there will be pallor region. So if someone is wearing a watch over here and the body is like lying supine, normally the hypostasis should occur over this part of the body. But what will happen is that since the watch is very tight, here there will not be any blood. So this whole area, the area that is covered by the watch, this whole area would be very, very pale, and this is known as contact pallor. And this contact pallor sometimes will give you a clue whether anything has been put there or not. And sometimes it can also confuse you if they are having a tight collar. So if there is a tight collar and that pallor region will confuse you to think about ligature mark. So this contact pallor is also important. You should have an idea about this contact pallor, so that only you can identify whether this is a case of lividity or it is a ligation mark. Like that you will be able to differentiate. So clear? Hypostasis, very, very important. Short notes will be asked in this, and lot of important questions in the NEET PG also asked from this. Clear? So next we are going to rigor mortis. So rigor mortis is stiffening. So rigor mortis is stiffening of muscle. So what happens is that right after death occurs, once the death occurs, there will be primary relaxation. All the muscle will go into state of relaxation. All your smooth muscles, all voluntary muscle, everything will go into a phase of relaxation. After some time, this primary relaxation will be replaced by the stiffening of muscle, and this stiffening we call it as rigor mortis. What actually happens in rigor mortis is that there will be depletion of ATP. So because of ATP depletion, this rigor mortis will occur, which will look like stiffening of the muscles. Now What is the order of appearance of rigor mortis? This is very, very important. Actually, if they simply ask you where you will first see the rigor mortis, then it is myocardium. So, the first site to show first site to show rigor mortis is myocardium. And if they ask you like externally, the first site to have rigor mortis, if they ask like this, then it is eyelids. Clear? So, overall it is myocardium that will go into rigor mortis first, but if they ask you specifically externally, then you have to say eyelids. So, this is the site of appearance. Now, what is the order of appearance? So, they have one rule known as Nysten rule. We will say that it is proximo-distal progression. Means it will start in the proximal part of the body, then it will move towards the distal. Means it will start in the shoulder and move towards the fingertips. So, starting from shoulder to fingertips, it will progress. So, it will start in the head, it will start in the eyelid, then it will go to the jaw muscle, then it will go to the neck, then to the trunk. Like that, proximo-distally it will go. That is the order of progression according to the Nysten's rule. There is one more rule known as Shapiro's rule. So, according to Shapiro, this is a biochemical process. The depletion of ATP, it is a biochemical process. So, this rigor mortis, it should occur all at once. So, it should occur all at once, meaning all the muscle should undergo rigor mortis at a same time. But we are seeing this proximo-distal progression because this muscle, this proximal muscles are more bulkier than the distal muscle. That is why we are able to appreciate quicker in this proximal regions. So, according to him, everywhere it is occurring at once, but it is more apparent in proximal part because they are more bulkier. Because of this reason, we are identifying this proximo-distal progression. This is his idea. So, according to Nysten rule, he says it comes in the proximal part initially, then goes to the distal part, starting from the shoulder, then to the fingertips finally. But according to Shapiro, he is saying it will come at all places at the same time. But we are experiencing it in the proximal part first because the muscles are more bulkier there. So, it is easily and readily visible to our eyes. That is the two rules of order of appearance. Next, we have another rule which deals with the time of appearance. This is known as rule of 12. According to this rule, the rigor mortis, it will appear in 12 hours. So, once the primary relaxation goes, it will become rigor mortis by 12 hours and it will stay for 12 hours and disappears in 12 hours. So, this is the rule of 12. Like it will come in 12 hours, it will stay for 12 hours and it will go away after 12 hours. Meaning, if you see a body by 12 hours after death, there will be rigor mortis, and by 24 hours after death, there will still be rigor mortis. But if you see after 24 hours, by around some 30 hours, 36 hours, the rigor will start passing away and the body will go into phase of secondary relaxation. Secondary relaxation. Clear? So, this is the progression of the rigor mortis, and using the time of appearance of rigor mortis and hypostasis, we can easily give the times in steps. For example, if a person is coming to you, like if the body is coming to you with fixed hypostasis and rigor all over the body, then what will be the times in steps? So, fixed hypostasis, it must be something between 6 to 12 hours. Rigor mortis all over the body between 12 to 24 hours, right? So, it has to be between this. So, you can say that at least 24 hours has passed, okay. Time since death is at least 24 hours, okay, and between 36 hours, it is 12 to 36 hours. Between these time, the time has passed. So, you can give the approximate time since death using this. Since it is already fixed and rigor is present all over the body, 12 hours must have crossed. So, 12 hours is crossed and rigor has not passed away yet, meaning 36 hours has not passed. So, the time since death is something between 12 hours and 36 hours. Like this, you will be able to give the idea to the police. So, this is the importance of studying the time of appearance of hypostasis and time of appearance of rigor mortis. Now, there are some instances where the appearance will be late. So, what are the condition is that if there is muscle wasting, like any prolonged illness, under such condition there will be late appearance of rigor mortis, and early appearance it is seen when the muscle is overworked, like tetanus, where you have repeated convulsion, and strychnine. So, all these conditions where the muscle is overworked, there will be intense activity of the muscle, there ATP depletion will be more faster. So, there will be early appearance of rigor under this condition. So, late appearance muscle wasting or any prolonged illness, early appearance convulsion condition like tetanus and strychnine poisoning. So, this is where rigor mortis will appear early and late, and there are certain conditions which simulate rigor mortis. What are those conditions? That is also important. So, first condition is your cadaveric spasm. Second is your heat stiffening. And third is your cold stiffening. And finally, gas stiffening. So, these are the conditions which rigor mortis will be simulating. So, you can suspect rigor mortis with differential diagnosis of these 4 conditions. So, now we will see the important difference between these. So, rigor mortis versus cadaveric spasm. This is very important. This is most frequently asked. They will ask you what is the main difference between rigor mortis and cadaveric spasm. So, the first thing, the main difference is that the very first thing that we have to do is absence of primary relaxation. So, we told that there will be a primary relaxation phase right after death. Only after that primary relaxation goes away, we will get this rigor mortis. But what happens is that this cadaveric spasm, it will happen right after the death, and this cadaveric spasm, it is seen in more violent death, and it happens instantly after death. So, this usually seen in like mostly some drowning or electrocution or gunshot injury. They will be seen like somebody, they will be seen holding the wire in their hand. They will be seen holding some aquatic plant in their hand, and they will be seen holding the gun in their hand. So, they will keep on holding it like this. They will have the gun in their hand and they will just keep on staying like this, and this group of muscle, they will instantly go into the stiffening, and this stiffening is known as cadaveric spasm. Normally, all other part of the body, it will go into a state of relaxation, but even if all other body is in relaxation, this will not go into relaxation. This will keep on stay very rigid. This is your cadaveric spasm, and it is commonly seen in violent death like this gunshot injury, electrocution, drowning, and sometimes if it is a case of homicide, they will be seen holding something of the murderer, like they will be holding some piece of cloth or some button or hair of the murderer, something they will be holding on to their hand. This is the main difference between these two, this absence of primary relaxation phase in cadaveric spasm, and this is seen only in case of violent death. But rigor mortis, it is seen in all death. There is no such segregation, like only in violent death you can visualize the rigor mortis. All death you can visualize rigor mortis. And one another important thing is that this rigor mortis, it is seen all over the body. All smooth muscle, all sort of muscle you can identify rigor mortis. But this cadaveric spasm, it is seen only in one group of small voluntary muscles. So, rigor mortis, like all your involuntary muscles, all your smooth muscles, all your voluntary muscles, everywhere you could see the stiffening. But cadaveric spasm, it is usually seen in only a single group of muscle. If it is hand, only the muscles of hand will be affected. If it is in the leg, only the one group of leg muscles will be affected. So, cadaveric spasm, it is very specific to a single group of muscle, and the most common muscle affected is your hand muscles. So, most common is your hand. This is where you will be experiencing the cadaveric spasm, and this, it is relatively easy to break off, and this is not easy to break away. So, this breaking off, like you can remove that stiffening, you can push it and the stiffening will go away, but cadaveric spasm, it is really hard to do. So, what happens is that once this rigor mortis occurs, it will stay for up to 36 hours, right? Only after that it will go away, right? This cadaveric spasm also same. It will stay till the decomposition shuts in. So, this is the main difference between rigor mortis and the cadaveric spasm. Apart from that, you had three other conditions, that is your heat stiffening. So, heat stiffening is what? This is your pugilistic attitude, right? So, heat stiffening is due to coagulation of muscle protein, and cold stiffening, this is usually seen in refrigerated bodies. So, refrigerated bodies and hypothermia death. Under these cases, you will be seeing this cold stiffening, and this is mainly due to like this cold temperature which freezes the muscle. So, due to freezing up of muscle, you will be experiencing this stiffening. And next is your gas stiffening. So, what happens in gas stiffening is that because of decomposition, there will be gas accumulation. So, decomposition will lead to gas accumulation that can result in stiffening. So, that is your gas accumulation, and it is seen mainly in decomposed body. So, these are the other conditions which will stimulate rigor mortis, and this cadaveric spasm is very important, and the main difference being absence of the primary relaxation phase and appearance of the instant method, and also it appears only in the smaller group of single group of voluntary muscles, which is especially hand. So, this is the main difference between rigor mortis and cadaveric spasm. So, rigor mortis, what we have seen, what is the mechanism behind rigor mortis and what comes before rigor mortis, that is your primary relaxation, and the mechanism is depletion of ATP. And what is the order of appearance? Generally, overall, if they ask you which is the first site, it is myocardium. If they ask you which is the external first site, it is eyelid. And the progression is proximo-distal progression according to Nysten. According to Shapiro, it is occurring all at once, but more apparent in the proximal because of the bulkier muscle. And rule of 12, it appears in 12 hours, stays for 12 hours and goes away after 12 hours. And late appearance, it is seen in muscle wasting, prolonged illness. Early appearance is tetanus and strychnine. And conditions simulating rigor, cadaveric spasm is very important. Apart from that, you have heat stiffening, cold stiffening and gas stiffening. This rigor mortis is very important question. You must know this. Next post-mortem change that we are going to see is Algor Mortis. So this Algor Mortis and another change known as post-mortem caloricity, they both deal with the temperature of the body. Temperature of body. So by Algor Mortis, what we mean is cooling up of dead bodies. Cooling up of dead bodies. And caloricity means hot body. So normally what should happen is that once a person died, during the post-mortem period, the body should cool down. There should be cooling up of body. That is a normal change. So that is known as Algor Mortis. And when it fails to do that, if there is persistent elevated temperature, if there is a persistent elevation of temperature, then we call it as post-mortem caloricity. They both deal with the temperature of the body. And temperature of the body, where we will measure is the ideal site is your ear or your anal canal or inside the brain or under surface of liver. So this is a site where you usually measure Algor Mortis. And Algor Mortis, what will do is that it will follow a sigma or inverted S-shaped curve. Like the pattern in which the temperature is lost from the body, if you plot it in a graph, it will give this inverted S-shaped curve. This is how the body temperature is lost, and depending upon the temperature, we will be able to identify the times in step. So what they will do is, they will measure the temperature of the body. They will put the thermometer in the ear or anal canal or the under surface of the liver. Any of these places they will put the thermometer and they will measure the temperature. And they will have already made a regression, like under this environmental condition, how much heat is usually lost normally. Like that they will have one formula, and in that formula they will apply this temperature and they will get the times in step. There are a lot of formulas depending upon the different environmental condition. Like the temperature, it will differ with each and every region and each and every season. Depending upon that, you have to alter your findings. So this is your Algor Mortis. And what is post-mortem caloricity? When the body does not cool down, when the temperature keep on elevating, like the body will be constantly hot. That is your post-mortem caloricity. And this post-mortem caloricity, it is usually seen when there is persistent heat protection in the body. So which condition can cause heat protection? So it is sepsis. When there is overload of bacteria, they can cause this post-mortem caloricity. Or if there is any failure of thermoregulation, like your heat stroke. If the person has died because of heat stroke, so there will be failure of thermoregulation. Under these conditions, you mainly see this post-mortem caloricity, and in some cases of convulsion like tetanus or strychnine poisoning, when there is like frequent muscle activity, there will be production of heat. So because of that also you can experience post-mortem caloricity. So basically by looking at the temperature of the body, we will try to decide the times in step. So this completes the yearly changes that is seen in the post-mortem thing. So immediate changes, what we saw, it is cessation of respiration, cessation of circulation and cessation of voluntary movements. Next to that we had yearly changes. We started with eye, where we saw the Tache Noire, Kevorkian sign, flaccidity of eyeball, loss of corneal reflex and changes in the vitreous concentration. And after that we started with hypostasis, then we had Rigor Mortis and changes in the muscle. Then after the Rigor Mortis, what we have is this temperature changes, that is Algor Mortis and post-mortem caloricity. So with this we are ending this early changes. What next is your late changes, and this late change is very important. So late change, each and everything will be as a short notes. So with late changes what will happen is that there will be decomposition of body. The body will undergo decomposition, and everybody will confuse with autolysis, decomposition and putrefaction. So what exactly the definition is that decomposition is a process which consists of two methods. One is a autolysis, another is a putrefaction. So what happens is that in autolysis it is completely aseptic. It is enzyme mediated. While this putrefaction, it is septic and it is caused by bacterial growth. So together autolysis and putrefaction will lead to decomposition of the body, and this autolysis, it is commonly seen in fetal death, like your IUD. In intrauterine death you will be getting to see something known as macerated fetus, and this is a form of aseptic lysis and we call it as autolysis, and this is mediated only by the enzyme, and the main enzyme that is involved is lecithinase. You have lecithinase. This is the main enzyme that will result in the autolysis of the body and cell, and the main bacterial organism that will lead to putrefaction is Clostridium belchi. So this is the organism that is responsible for the process of putrefaction. So autolysis, aseptic condition, only the enzyme, autolytic enzyme, that is your lecithinase, is involved. This decomposition, another process is putrefaction, which involves whole septic process, bacterial overgrowth, especially your Clostridium belchi bacteria. Now in the decomposition you usually see certain changes. First is your color change, next is your gas formation, and we will also see something known as liquefaction or colligative liquefaction. So these are the main things that we will be noticing in the body. So we will see each and every one. So first what will happen is the color change, and the color specifically it is green color, and it is seen first over the first site externally, it is seen over the RIF, that is your right iliac fossa. This is where you will be seeing this green color discoloration, and why this green color and why this site we will see. So why green color is that all the bacteria what will do is they will produce hydrogen sulfide gas, and this hydrogen sulfide along with the bacteria, they will travel all over the body along the blood vessels. That is the only route available for the bacteria. They will travel along the blood vessels, and when this hydrogen sulfide travels along the blood vessel, it will go combine with the hemoglobin in the RBCs. So it will combine with the hemoglobin, and these together will form sulf-meth hemoglobin. So when these two combine, hydrogen sulfide and hemoglobin, they will form this sulf-meth hemoglobin, and color of the sulf-meth hemoglobin is green, and this is why you get this greenish discoloration over the body. So clear? Why we are getting this greenish discoloration? It is due to bacterial overgrowth which result in excess hydrogen sulfide production, and this hydrogen sulfide will go combine with hemoglobin forming sulf-meth hemoglobin, which gives this typical green color appearance. Done. Now why this external side right iliac fossa? Why is that? This RIF fossa, the content, it is more liquid, and this environment is apt for bacterial growth. amongst all the intestinal region, this area is more apt for bacterial growth. So, that is why this greenish discoloration appears over the RIF. It is also more superficial. So, you will get to see the greenish discoloration over the right iliac fossa first. This is the first site externally. Internally, which is the first site is? First site internally is your intima of aorta. You will get to see this green color. So, this is the internal site where you will be able to see this greenish discoloration first. So, the main color change is green color, and the first site you will be seeing in the abdomen, and internally it will be seen over the aortal intima. Now, there is something known as marbling. So, what marbling is? This is also one of the color change. You will have greenish discoloration of the skin over shoulder and upper arm. So, the shoulder region, this upper arm region, there will be greenish discoloration, and this greenish discoloration, this will look like a road map. So, road map course appearance or geographic pattern. They will say it is geographic pattern. So, what happens is that when this hydrogen sulfide, they go through all the blood vessel, they will stain the blood vessel. So, all the blood vessel will become green in color, and it usually start in this upper region. This upper arm region, it usually starts, and you can see it all over the body as the time progresses, and it usually starts by 36 hours of time, and it is very important. By 36 hours it will start, and it starts in the most commonly seen in the upper arm and shoulder region, and it will look like a road map. So, it gives a coarse road map geographical appearance. So, this is your marbling, and it comes by 36 hours. Later on, it will be seen anywhere over the body. Along the pathway of the blood vessel, it will be seen. This is mainly due to the sulfmeth hemoglobin, which is caused by the formation of hydrogen sulfide combining with the hemoglobin. Clear? So, this is your color change. So, everywhere it will become like this color, and as the time progresses, everything will darken. So, darkening happens further, so that everything will become very dark, and very black color appearance will be seen over the body. The face, abdomen, everything will become very dark. This is the color change. Next, what will happen is gas formation. So, this gas formation, the same hydrogen sulfide, all sort of gases will be produced by the bacteria. So, this gas, it will start accumulating all over the body. So, initially it will start forming blisters. So, these blisters, they will combine together to form very large blebs. So, underneath the skin you could see large bubble like lot of blebs will be formed, and this blister, everything will come together forming a very big blebs. Everything happens because of the accumulation of the gas. So, this is usually seen over the skin. Next, what will happen is that when the gas accumulate in the abdomen, there will be distension of the abdomen. So, the abdomen, it will look like a dome. So, very tight dome it will be looking like, and when you pierce, the gas will suddenly come away. So, this very common in autopsy. If you see a very extended, distended dome like abdomen, you have to be very careful while poking the abdomen. So, this is next thing. So, when gas keep on accumulating in the abdomen, what it will do is, it will go push the diaphragm. So, it will go and push the diaphragm. Because of this, all the thoracic content, everything, every blood and all the secretion in the lungs and thoracic cavity, it will be pushed out. So, you will have something known as purging. So, purging is fluids. It can be blood tinged also. So, fluids coming out of all the secretion, along with that everything will be coming out of your orifices. Like your nose, mouth, there will be fluid coming out of this. This is known as post-mortem purging, and this mainly happens due to accumulation of gas in the abdomen, which pushes your diaphragm up. So this is the reason for this post-mortem purging. Up next, the gas, it will accumulate in the prostate. So you will look like a hydrocele like appearance. So this scrotum, everywhere you will be seeing enlargement because of the accumulation of the gas. Up next, you can also see prolapses, like uterus, everything will prolapse because of the increased abdominal pressure. Everything will come out of the orifices. So prolapses of the organ will be seen because of the excessive accumulation of gas. So these are the main changes. Initially there will be blisters which will coalesce to form the big large blebs, then abdominal distension, scrotal distension, then postmortem purging, and even prolapse of the uterus. As it keep on happening, what will happen is that by second, third day, there will be loosening of nail, hair and teeth. So between 3 to 5 days, all these will happen. So there will be loosening of nail, the hair will loosen and teeth can be easily plucked, and the skin in hand and feet, it will peel. Like a glove, it will come off. So this can also happen. All these external changes will happen. And after that, what will happen is that something known as liquefaction. So liquefaction is becoming liquid. And this happens to the internal organs. So we call it as qualitative liquefaction. So what happens is this, the more softer the organ is, the more rapid the liquefaction. It will liquefy. So all the softer organs, starting from your larynx, and it will go to the brain, then like depending upon the softness of the organ, it will go in a sequence. So everything will become very, very liquefied. And the last organ to liquefy, if they ask like that, it is your bone and nail. So this is the last organ to liquefy or decompose. And if they like plainly ask you without giving bone or nail, in males, which is the last organ to decompose, then it is prostate. In females, if we ask you which is the last organ, then it is uterus, especially nulliparous uterus. It is not gravid uterus, it is nulliparous uterus. So if they simply ask you without giving bone or nail in the option, in males it is prostate, in female it is nulliparous uterus. If it is a recently delivered uterus or a multiparous uterus, then it will also undergo liquefaction faster. So this is the change that will be seen in the internal organs. So late changes, it consists of autolysis and putrefaction. Autolysis, it is a aseptic condition, and putrefaction, it is a septic condition. Aseptic condition, it is done by the lecithinase autolytic enzyme. Septic, it is done by the Clostridium welchii reaction. Now we mainly have color change due to the hydrogen sulfide, gas accumulation which will lead to distension, postmortem purging, then prolapse of the organs, then finally you will get the liquefaction of the internal organs. So the last organ to decompose is your bone and nail, and without nail and bone, if they ask you, in male it is prostate, in female if they ask you, it is the nulliparous uterus. Now there is some concept known as Casper's dictum. So this Casper's dictum, what it is used is that it is used to predict about the decomposition. So different environmental condition, what the effect it has on decomposition, it is said in this Casper's dictum. Generally, with decomposition, what happens is that if there is extreme of temperature, if it is hypothermia or hyperthermia, then the decomposition will slow down. This is generally the reason for decreased decomposition. And if there is any heavy metal poison, then also decomposition will slow down. Or if there is any use of antiseptic, something like phenol, this will also reduce the rate of decomposition. And there are certain conditions which will increase the rate of decomposition. That decomposition will occur very sooner. Those conditions are sepsis, any prolonged infection, and the ideal humid temperature. In these conditions, you can expect faster decomposition. So, this is what normally happens. Now, what Casper's dictum tried to tell here is that how the decomposition rate is differing between soil, air and water. So, they have given one ratio, 1:2:8. So, 1 is for air, 2 is for soil and 8 is for water. So, this is in a decreasing order. So, this is in a decreasing order. So, 1 is for your air, 2 is for your water and 8 is for your soil. So, it will go in a decreasing order, meaning in one day, one decomposition would have happened. Like we will see decomposition of your internal organ. Let's just say, like in one day, in a decomposition of internal organ has happened. The same decomposition of internal organ will happen only after 8 days in soil. Clear? The amount of decomposition that has happened in one day in air will take at least 8 days in soil. Clear? So, in water it is rapid and in soil it is slower. And water is a bit slower than the air but a bit faster than the soil. So, this is the Casper's dictum, 1:2:8, air, water and soil. So, this is the Casper's dictum and this is helping with the decomposition rate. And next we have modification of putrefaction, which is very important. So, there are two modification of putrefaction. One is mummification and another is adipose formation. So, here do you see this one? The body, it is very dry, dehydrated and shriveled, right. So, this kind of brittle and black body, this is what we call it as mummification. We might have seen lot of mummified bodies and this is very common in the Egypt. In all those pyramids, they will have this mummification done. And adipose formation is, this is very bloated, whitish, grey, waxy or soapy appearance. So, when it is very waxy, soapy appearance, you will call it as adipose formation. Now, the main difference between these two, we have your mummification, then adipose formation. So, what is the mechanism between these two? In mummification, it is mainly due to dehydration. Dehydration of the body is the mechanism. In adipose formation, the reason is saponification, that is hydrogenation and hydrolysis of fat that is present in your body. So, the body fat, it will become fatty acid and finally it will become soap. So, that is the saponification or adipose formation. And in this, there is one important thing that they will ask, that is the environmental condition. This is seen in hot and dry climate. And saponification means soap formation, right? So, it has to have some moisture. So, this is seen in humid and hot condition. Just remember, both should be hot. If it is dry, it will become dehydrated and mummified. If it is humid, it will become soap and adipose formation will happen. So, this environmental condition they will ask you. And this smell, it will have a putrid or rancid, offensive, sweetish smell. The smell will be very bad, intolerable. Okay, it will have a very bad smell in case of adipose formation, and this mummification very rarely it will smell bad. And in both the cases, what happens is that this facial feature and injury is preserved. So, in both cases, you will have the preservation of the facial feature and the injury. And time since death, it can be identified in both the cases. And next difference is that mummification, it will happen from external to internal, while saponification, it will happen from internal organs to external organs. When you compare both saponification and mummification, the mummified body will be more brittle than the saponification. So, this mummified body, it will be black, brittle, dry, dehydrated, while this saponification adipose body will be very waxy and it will be mainly seen over the fatty regions. It will start where there is more fat, like your face or buttock, where there is more fat present. This is where you will be seeing this adipose formation. While this mummification, it will start from the external parts, like your fingers, digits, from there it will go internally. So, which part will dehydrate first? The most external part, right? So, from the external region, it will go into the internal organs. And this difference between mummification and adipose formation, this is very important. So, this is the late changes. We saw decomposition comprising the putrefaction and the autolysis, and modification of decomposition, which consists of this mummification and adipose formation. So, next to that, what we are going to see is embalming. So, embalming is where you will inject formalin into the body for preservation. So, when you want to preserve the body, you will inject formalin and that will preserve the body. The body will go into a rigid state and without decomposition, it will be preserved for a very longer time. This is basically embalming. So, this rigid state is helping us to prevent decomposition. So, basically embalming, you will use formalin. Along with that, you will use water. This formalin is your preservative, water is your vehicle. Then you will use sodium citrate as an anticoagulant and sodium borate as the antiseptic. So, all these components, formalin, water, sodium citrate, sodium borate, everything will compose of the embalming liquid. So, when we say we are doing embalming, we are not simply putting formalin, we will add all these things. We will add water, we will add this antiseptic, we will add this anticoagulant, everything will be added and with embalming solution would be formed, and this embalming solution, it will be injected into your body via the arterial network. So, what they will do is, injection, continuous injection and drainage. This is what they usually do. Sometimes they will do discontinuous injection and drainage. So these are the techniques through which this embalming fluid is pushed into the body. But this embalming, the most important thing we have to remember is it should be done only after autopsy. If the person, they have to do autopsy, they can do this embalming only after completing the autopsy. Why? Because this will alter the wounds and nature of the blood. So everything will be altered. Your toxicological analysis, nothing can be done. It will fail. Toxicological analysis will fail. So only after completing the autopsy, after preserving the samples, you can do the embalming. The most important thing is that this embalming, it will reduce the rate of decomposition. And at the same time, it can also alter the facial structure, all your facial structure, body structure, nature of the wound, dimension of the wound, everything will be modified. So it is better to do the autopsy first and then we can continue the embalming. So this is the main thing that we have to know in embalming. Next, what we have is entomology. So entomology means study of insects. That is what entomology means. But what we are going to see now is forensic entomology. So what forensic entomology definition is that it is using entomological knowledge, for administration of justice. So simple, just like how forensic medicine definition, like usage of your medical knowledge for administration of justice, right? Just like that, entomology is using the entomological knowledge for administration of justice. So basically what we will be seeing in forensic entomology is, we will be seeing about all the maggots and few flies. So this maggots and flies, there are few important species. Those are like blue bottle fly, then green bottle fly, then obviously our house fly. So these are the few important species that we will be closely dealing with in the forensic entomology. The usage of forensic entomology is, there are different uses. First use is that it is used in the identification of place of body disposal. Next is time since death identification. Then finally, toxicological identification. So what happens is that we will use the entomological knowledge to identify the place of body disposal. What we mean by this is that sometimes what will happen, the body will be killed at some place and it will lie there for some days, and because of some animal activity or due to some intentional activity, the place of the disposal, it will be varying. That some animal, it will throw the body, it will just drag the body and throw the body somewhere else, or people will intentionally take the body and throw it somewhere else just to confuse the evidences, just to avoid the appearance of evidences. They will change the location of the body. Now using the entomological language, entomological knowledge, we can identify the place of the disposal. Next, we can identify the time since death by looking at the type of species and looking at the growth in the entomological knowledge. We can use the time since death identification. And toxicological identification, By killing that insects and doing analysis on this insect, we can identify whether any poisoning has happened or not. So these are the ways where entomological knowledge is applied for the administration of justice and law. So we will see how it is usually done. So what happens is that when a body lies in an open space, all the flies, especially house fly in this blue bottle and green bottle fly, they will come and they will lay eggs, and this will happen like within hours. Within hours they will start laying eggs. These houseflies, they will come especially around the orifices, it will come start laying eggs. And after laying eggs, in few days what will happen is that you will get the larva, that is your maggot. The maggot is your white color rice like small insect. Okay, these small insects are known as larva or maggots. So this will appear in few days, and this larva, it will go into first instar, second instar, like that. It will keep on increasing in the size. The size will increase. So initially what will happen, when a body is lying in an open space, the flies will come and sit, they will lay the eggs. It will happen in few hours. So once the eggs are laid, after few days, from those eggs larva will hatch and it will look white in color, and we call those larva as maggots. And these maggots, what they will do is, they will keep on feeding the body. Okay, they will feed on body tissues. It will eat away all the body structures. Okay, so it will eat them and it will start increasing in size, and each and every size we have a measurement depending upon the time duration, and we call them instars. First instar, second instar, like that we call them. And after this larval stage, what they will do is, they will become pupa. So they will become pupa, and from this pupa new fly will emerge. So this is the life cycle of the insects. So they will come, lay eggs, become maggot, then increase in size, become pupa, and from pupa new fly will come out. So this is the life cycle. And the difference from one stage to another stage, what is the time duration that it takes? It is specific to each species. Each and every species of fly, they will have a particular duration. So we have knowledge about this duration and we have knowledge about this species, and using this knowledge we will use them for identifying the time since death. So this is how we identify the time since death. Now how will we identify toxicology is that we will take this larva, these maggots we will take, and we will subject the maggots to toxicological analysis, because they eat away the body tissue, right? So the poison that is present in the body, it will be ingested into this maggot. So by analyzing the maggot, we will be able to identify the poison. So this is how the another usage is coming up with. So first usage, time since death. Second usage, toxicological analysis. And how we identify the place of disposal? How we identify is that each species is specific to that place. Like most of the species, they are specific to the place. So through that we will be able to identify the place of disposal. So this is how the entomological knowledge works in the forensic setting. And to do this, what we have to do is, we preserve these maggots. And how we preserve maggots, that is the work of the forensic surgeon. So what we usually do is, we take the maggots and we put them in the boiling water, and we will then store in acetic alcohol. So we will take the larva, we will put them in the boiling water, that will instantly kill it, and we will preserve them in acetic alcohol. So, why we are doing that is, that will help us to know the size or the length of the larva, through which we will be able to identify the stage of development, and by identifying the stage of development we will be able to see the time since death. So, this is one batch, and another batch what we will do is, we will preserve live maggots along with body tissue. Along with body tissue, we will be preserving few maggots. We will let them grow. So, they will grow into fly, and this is done to identify the species, which exact species this larva is becoming, that we can identify using this. So, you preserve two set of maggots. One, it is killed instantaneously, and we will measure the length and we will use it for the time since death analysis. Second maggots, we will preserve them alive by storing them along with some body tissue, and we will let them grow into a fly, and by seeing at the fly we will be identifying the species. So, this is how entomological investigation is done. Clear? So, this is about the forensic entomology, and all the post-mortem changes, it will be coming under this post-mortem taphonomy or forensic taphonomy. When they ask you about forensic taphonomy, you have to start with all the decomposition changes, right from the immediate changes, then early changes, late changes, this entomology, everything you have to write. This all comprises the forensic taphonomy part. So, this entomology, it is a practically important thing, and they can ask you, what is the usage of forensic entomology? What are the things that we can identify using the forensic entomology? Like that they will be asking you question. Up next in thanatology, there is one important topic that we have to do, that is death certificate. So, this death certificate, this is very important in relation to your practical purpose. Practical as in your university practicals and the practical purpose in the real world. So, death certificate, it is also known as MCCD, meaning medical certification of cause of death, and this is usually filled in form 4 for institutional death and form 4A for non-institutional death. So, this is how it is usually filled. So, in the death certificate, there will be, like, initially you will have one part where you have to write the demographic details, like the name, age, sex, date of admission, date of death, duration of illness, hospital and ward name. Everything it has to be filled in the first part, and comes the main part where you will be asked the immediate cause. What is the immediate cause of death? It will be asked 1A, B, C. Then you will have contributory cause. Then you have secondary cause, that is 2. So, here what is that? This 1A you have to mainly fill. What is that? Here, if it is a case of myocardial infarction, okay, if it is a case of myocardial infarction, and if the person dies, what you have to write in 1A is myocardial infarction. You can only write the cause of death, not the mode of death or mechanism of death, that is your cardiac arrest. You cannot write that. And this BNC is your contributory cause. There, if you have any condition, like they had coronary artery disease, if it is there, you can write. So this is what is usually filled in this B and C. If they have any other presiding condition, like few condition, they will have 3 or more chronology. Like for example, if someone is dying because of perforation peritonitis, because of ulcer. So here what you can write is, like from the chronology, what happened first, you can write. You can see first, right? In C you can write ulcer, peptic ulcer. In B you can write perforation. And finally here you can write peritonitis. So like this, from the chronology, the first thing will come in the last column, and thing that happened after that will come in between, and the thing that happened at last will come at the A. So this is how the event is right. So all these things you will be writing in the immediate cause, and contributory cause, the condition that started with, you will be writing. So next, in secondary cause, what we will write is any significant condition which directly did not cause. So this is any significant condition that directly did not cause death, like you have to write any other significant condition. Usually here it will be like mostly your diabetes, your type 2 diabetes or systemic hypertension, everything will be filled here. And along with it, you have to also write the duration of illness. The duration of illness should also be written along these diseases. So this is how you usually fill the MCCD. The main thing you have to note down is that you should never write the mechanism of death. This is very big mistake, and this should be avoided, and you should avoid using abbreviations. Like how I have written here, type 2 diabetes mellitus, systemic hypertension, these kind of abbreviations should be avoided. And if it is a case of female, you have to write the pregnancy details, whether she is pregnant or not, that we have to mention. And finally, manner of, this is very important, it should be mentioned. And along with that, you also have to put your sign and registration number of the medical officer. The one who is treating, the treating officer should put their sign, name and registration number in that. So all these things should be followed while writing the MCCD. 4 is institutional death, 4A is for non-institutional death like home death. So anyone who is a treating doctor, anyone who has seen the patient recently, they can give the MCCD in case of non-institutional death. Otherwise, you have to send the body for autopsy. If you are not sure about the cause of death, you can send it for autopsy. If you know that the person has been suffering from something life-threatening, and if you are sure that it is the cause of death, even if it is a home death, you can give with relevant medical record, you can give the MCCD. So this is about the medical certification of cause of death. Up next, we have something known as presumption of survivorship and presumption of death. So these are two different concepts. So first we will start with presumption of death. So any person who's been missing for more than 7 years, if they are missing for more than 7 years, they are considered dead until proved otherwise. So this is presumption of death. So what is that? Like if someone is going, like nobody has heard of him for some few years. So we can take an example with this. Like there is one husband and one wife, and we have one sibling of the husband. So what happens? This husband, he is a very rich person, and the wife and sibling, they don't like each other. So what happens is that this husband, he goes missing for few years. Now, the sibling, what he wants to do is, he does not want all the money to go to the wife. So, what he will do, he will come and say that my brother is missing for 3 years. So, I want to pronounce that he is dead. So, you can give the property to me. Since the husband is dead, I can have the property with me. Like that, the sibling will go and complain in the court. But the court, what will they say is, up to 7 years you can wait. Okay, even after 7 years you have not heard from him, then we can say that person is dead. So till then, if the sibling, if he proves the death of the brother, that he have to bring some body or he have to bring some sort of medical certificate, unless he proves that the brother is actually dead, he cannot claim the property. This is the scenario up to 7 years. Once the 7th year is crossed, what will happen is that now the court will presume that, they will assume that the brother has died. And if the wife want to say that the husband is alive, she has to come up with some proof of life. So this is how this works. So up to 7 years, if a person is missing, the court will assume that the person has not died. But once the 7 years mark is crossed, the court will assume that the person has died, and unless it is proved that he is alive, the court will consider the brother as dead and he will issue the property to the sibling. So this is the presumption of death. Now comes another term, that is presumption of survivorship. So this is something used in mass disasters. If lot of people are dying at a same time, we will use certain criteria to decide who would have died first. Who would have died first? Then lot of people die at same time. So this presumption of survivorship, it was very useful in older times, when the transfer of the properties, it was happening in the order. Like for example, only between the male heir the property will be distributed, right? So they will try to see whether who died first. So the person who is old, if they are female, or if they are having any ailing condition like any disease, we will consider them to, they would have died first. This is what our presumption. This is how we presume. And if it is the husband, first husband, then what will happen is that if the husband had died, then the property, it will go to his sibling. But if the husband had not died, the sibling had died first, the property will go to the, after that the husband had died, the property will go to the son of this person. So this is how this presumption of survivorship works. So what you have to know is that in case of presumption of death, the court will assume till 7 years that the person is alive until unless proved died. So this is what you need to remember, this 7 years. And this presumption of survivorship, this is usually done in mass disaster when lot of people have died at the same time. So while analyzing the physiological condition, we will come to decide who would have died first. And this was used to be done in the older times where the property division was used. But nowadays this is not that much important. So with this, we are concluding this thanatology. And thanatology is a very important topic. Post-mortem changes, we have to remember each and every part because everything can be asked as a short notes. So thank you for watching.